Hello everyone. Today I'm going to show you a new and easy technique for reducing shoulder dislocations. This maneuver was developed by Dr. Majid Negari, an orthopedic surgeon, and has been published in the International Journal of Orthopedics in 2026. This method is named the Rational Technique for Shoulder Dislocation Reduction. It is designed based on the biomechanical and physiological standards of the shoulder joint. From an anatomical and physiological perspective, when the elbow joint is flexed at an angle between 90 to 100 degrees, the shoulder is placed in about 30 degrees of abduction and approximately 20 degrees of forward flexion. In this position, all the muscles surrounding the shoulder and arm enter a state of complete rest, free from any tension or contraction. We term this state the semi-physiological position. Naturally, applying traction in this position is much more logical and appropriate for reduction, because muscle tension and contraction no longer create any obstruction to the reduction process. You might wonder how we initially position the arm into this state. The answer is that there is no need to measure the aforementioned angles. You don't need a protractor or a ruler. The method is designed in such a way that as the maneuver begins, the arm automatically falls into this semi-physiological position. Now, it is best that I demonstrate this maneuver to you so you can see the steps in action. Before starting the maneuver, proper anesthesia is essential. We can utilize either general anesthesia or a regional approach. For local management, we can intra-articularly inject 10 to 20 milliliters of 1% lidocaine directly into the shoulder joint. Now, as we begin the maneuver, the patient is lying supine on the table, and the arm is set in position. I interlock my hand with the patient's hand, and we gently and progressively apply traction along that semi-physiological angle. And here is the important point. In the vast majority of cases, whether it is an anterior or posterior dislocation, the shoulder reduces spontaneously right during this initial progressive traction phase. However, if it does not reduce immediately, my other hand remains free. From beneath the patient's armpit, that free hand can easily guide and push the humeral head directly back into its anatomical socket. Once the reduction is successfully achieved, the shoulder must be properly stabilized. We place the arm in a special shoulder immobilizer or stabilizer, accompanied by a dedicated support pillow to keep it secure. This immobilization protocol should be maintained for a duration of 4 weeks. Thank you very much for your attention, and I hope you found this demonstration helpful.